And welcome. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and the VA's Office of Rural Engagement, ORE. My name is True Lester Pauling. I am the Senior Outreach Specialist in CFBNP. I will be your moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. This presentation will be made available after this webinar. This is a live recording. I would like to thank Mr. David Clay Ward for this collaboration. We are grateful for your time today. But before we get started, I would like to introduce Mr. Conrad Washington, Director of the VA Center for Faith-Based and Neighborhood Partnership. Mr. Washington is a retired combat Marine with 20 years of active duty service. He is a licensed minister actively serving in his faith. He received his Master's of Divinity in Pastoral Studies from Moody Theological Seminary. He has a Master's in Business Management and a Bachelor of Science degree in Education. Additionally, he is a graduate of VA's class of 2017 Virtual Expired Leaders Program. Mr. Washington?
Thank you, True. I appreciate it. And thank you all for joining us today. We are grateful that you took time to stop by again as we continue to have webinars that I believe are informative to the community that we serve, which are faith-based community organizations and veterans and families and beneficiaries. So we're glad that you're here. Today we have a special guest, my colleague in OPIA, the Office of Public and Intergovernmental Affairs, Mr. David Ward, better known as Clay. So Clay, thank you, sir, for taking time out of your schedule to join us and share good information from the desk of the rural space that you're governing. Rural is an important area for the VA because we know that that area is geographically considered remote or sort of like a frontier place. And so Clay's going to share some good information for us that's applicable. But thank you again for joining us. And I hope that you get a lot out of the brief today. So thank you.
Thank you, Mr. Washington. At this time, I would like to introduce Mr. David Clay Ward, who will be providing today's presentation. Please read a summary of his bio on the screen. Mr. Ward serves as the Rural Desk Officer for VA's Office of Rural Engagement, ORE, an office within the Office of Public and Intergovernmental Affairs. As the Rural Desk Officer, he leads the VA in collaborations with the White House Domestic Policy Council, Rural Partners Network, RPN, and the Rural Prosperity Interagency Policy Council. Through the RPN, federal agencies are renewing their commitment to rural communities by providing targeted staffing, tools, and resources. For VA, the ORE engages with internal and external stakeholders to deliver outreach, communications, and coordination with rural communities so that veterans can more easily access the health care, benefits, and other resources they have earned. Clay has extensive experience working in the Indian Health Service, tribal health programs, urban Indian health programs, and rural communities. He recently served in VA's Office of Tribal Government Relations as a program analyst and the designated federal officer for the Advisory Committee on Tribal and Indian Affairs. Clay is a tribal member of the Choctaw Nation of Oklahoma. Clay received a Master's degree of Science and degree in Human Resources Counseling from East Central University and a Bachelor of Arts from Southeastern Oklahoma State University. In 2022, he completed the Public Health Training Certificate in American Indian Health at the Johns Hopkins Center for American Indian Health. At this time, I give you today's presenter, Mr. David Clay Ward, for today's presentation. Clay?
Thank you, True, and thank you, Conrad, for that kind introduction. I'm honored to be here today, and thank you for joining us today for this presentation. As True and Conrad said, I'm the Rural Desk Officer for the Office of Rural Engagement, and I'm also the Acting Director for the Office of Tribal Government Relations, where I worked previously before coming over to ORE, the Office of Rural Engagement. And today I'll be presenting on an overview of VA's Office of Rural Engagement. So let's get started. I wanted to start by telling you a little bit about myself. As True had mentioned, I'm a citizen of the Choctaw Nation of Oklahoma, and that's my tribal logo in the top left corner there, the yellow and blue logo. I graduated with a master's degree at East Central University in Oklahoma and completed a public health graduate certificate at the Johns Hopkins University Center for American Indian Health, and that logo is right there in the right bottom corner. The middle photo is from the Native American Heritage Month at the White House last year, and the photo at the bottom left is my dad, who was a Vietnam veteran in the Army's 82nd Airborne Division. Next slide, please. I wanted to mention that I am not a veteran myself, but I come from a long line of veterans in my family. I have a relative who was a Choctaw code talker from World War I by the name of Calvin Wilson, and you can see his headstone in the top left corner. The black and white photo in the middle is another relative by the name of Joshua Wilson. He's on the left side there in that black and white photo. He was killed in action in World War II and is buried in the Normandy American Cemetery in France. On the far right side is my brother, and he's a tribal councilman with the tribe. And he was fortunate to go to France this past year along with our tribal delegation, the Choctaw tribal delegation, and visited the Norman American Cemetery to honor our Choctaw veterans that are buried there. If you look close at the white cross that he's next to, that's Joshua Wilson's marker that I mentioned, who was killed in action in World War II, one of my relatives. And then I have younger cousins and other relatives who are currently serving in the armed forces, and you can see that in the corner left, bottom left of the slide there. And then I have other cousins who are serving that are related to me. Next slide, please. So let's get started. I want to start out with the rural demographics and showing you this map of rural prevalence in the United States. It displays urban, rural, highly rural, and insular items to give you a picture or an idea of the rural landscape that we work with. Next slide, please. This slide shows a snapshot of rural veterans who are enrolled in VA as compared to urban veterans who are enrolled in VA. As you can see, the demographics for rural veterans on the left side, there are 4.4 million rural veterans with about 2.7 million enrolled in VA. And I'll just kind of go over some demographics here. 61% of rural veterans are enrolled in VHA system and is significantly higher than the 41% of urban veterans. 58% of rural veterans have at least one service-connected condition. 8% are women, 10% are minorities, 44% are less than $35,000 annually. 25% do not access the internet at home. And rural veterans enrolled in the VHA system are also significantly older. 55% are over the age of 65. This older veteran population is medically complex and more likely to be diagnosed with diabetes, obesity, high blood pressure, and heart conditions that require more frequent, ongoing, and costly care. So I always thought that was a good slide to look at and start out with as a snapshot. Next slide, please. And then I wanted to touch on some of the challenges of rural areas that include the healthcare challenges. And if you look at this diagram here, provider or workforce shortages is a big factor here. Geographic and distance barriers, transportation, getting to healthcare centers, medical centers, limited broadband coverage is another one that we work with, and just having that limited barrier. And what we call the social determinants of health that include housing, education, employment, and transportation, as you can see there in the bottom left side. So those are some of the challenges that we have to look at and we have to work for or to consider while we're working with rural veterans. Next slide, please. And that was just an introduction of some of the rural demographics that we work with. I want to do an overview, like I said, for the VA Office of Rural Engagement. The Office of Rural Engagement represents the department on the Rural Partners Network and serves as the VA Enterprise Integrator for rural veteran issues. In March of 2022, the White House Domestic Policy Council launched the Rural Partners Network, what I call the RPN for short, to transform the way federal agencies partner with rural communities. Under this initiative, federal agencies are charged to identify a rural desk officer to collaborate with the RPN, Rural Partners Network, and harness agency resources to meet the needs of rural communities. VA established the RDO, or Rural Desk Officer position in VA, and I was then hired in October 2022. So I've been here just barely over a year, and this was a very new office. So I've been standing up this office since then, and just recently hired 2 staff members in December. They are Alex Hightower, who is from Virginia Beach area, and Michael Billings, who is located in Kansas. So we have them in locations where they can cover different regions. For instance, Alex can cover the East Coast as well as the southern states, all the way up to the northeastern side of the United States. And then Michael Billings can cover the central part of the U.S. as well as the western side. So we only have 3 staff members, but I think we're a small and mighty team and work well together. Then below, I listed a few of the VA stakeholders that we work with as we go along on this journey. So you can look at, I listed the Office of Public and Intergovernmental Affairs that we are located under, also working with the state and local governments, Center for Faith-Based, who's sponsoring this webinar today, Tribal Government Relations. We work very closely with the Veterans Health Administration, VHA Office of Rural Health. We work with VBA Outreach, Transition and Economic Development, Office of Connected Care. So we work all along the 3 administrations within VA. Also working with Veterans Experience Office, and they're located throughout the country, who's a great partner. And the National Cemetery is another administration within the VA, Office of Enterprise Integration, Secretary Strategic Engagement, and VA Service Organizational Liaison. Next slide, please. I wanted to show you where we're located in this organizational chart. This is our VA organizational chart that we are located within the Office of Public and Intergovernmental Affairs. You can see us under the Secretary's photo on the right side there. He's just right below that Office of Public and Intergovernmental Affairs. Next slide, please. So under the OPIA, for short, Office of Public and Intergovernmental Affairs, we have the Office of IGA, Office of Intergovernmental Affairs, and that's where we are located, Office of Rural Engagement, along with the Center for Faith-Based and Neighborhood Partnerships, Office of Tribal Government Relations, and Office of State and Local Government Affairs. Next slide, please. This slide shows our purpose, our mission, and our vision. Our purpose is to leverage strengths and resources of the VA and veterans to build resilient rural communities to improve the health and well-being of veterans. Our mission is to serve rural veterans by connecting VA programs and policies to their unique needs and by using a whole of government approach to support and engage rural veterans. Our vision is to transform how the VA partners with and delivers access to healthcare and benefits to rural communities across the United States. By working with RPN, the Rural Partners Network, the Office of Rural Engagement will bring the federal government to veterans across rural America. Next slide, please. This slide shows the Office of Rural Engagement goals. First of all, we serve as a front door for rural veterans, families, and communities. We also assess VA policy implications that affect rural veterans. And that may be through VA, that could be through the White House Policy Council, anything dealing with the policies that, like I said, that affect veterans. We conduct outreach to engage rural veterans and their advocates. And then we're working on piloting technical assistance for rural communities. So that's more in the future to come, since we have the new staff now, that we can start looking at doing that kind of work in the rural communities and more partnering. Next slide, please. Some of the Office of Rural Engagement roles are to coordinate with the VA enterprise, and that's by connecting VA offices with rural issues or rural connections. So sometimes we get questions about rural veterans or rural issues that come in, and we, as the Office of Rural Engagement, try to connect what office can work best with that. And that's what helps us to get some of our goals completed. And we are an advisor to rural initiatives. That goes from the secretary all the way down to the 3 administrations within the VA. We align policy initiatives, as I mentioned earlier. And then in the future, we look to create a community of practice, and that deals with not just VA internal stakeholders, but also our external stakeholders that we work with. And then we coordinate with rural communities by communication. We look at data and resource sharing with rural communities. We look at community priorities, and then we like to collaborate with the rural communities that we work with. Also, one of our big things is outreach and engagement. So we're trying to engage as much as we can with rural communities. And on the RPN federal side, we work with the White House Rural Interagency Policy Council, and our office is the point of contact with the White House on that initiative. And then we collaborate with other federal agencies. And I'll show you a slide here in just a bit that shows the different agencies that we work with through this Rural Prosperity Initiative. And then we look at data sharing, sharing resources. Again, I'll show that slide, the data that we do share and the resources that we share. And then we share best practices throughout the federal government. Sometimes it doesn't always align with VA and working with the other federal agencies, because we work specifically with veterans, and the other agencies tend to work with grant opportunities or funding opportunities. So we try to figure out how we're going to fit in with that, and then educate other federal agencies as well. And then we look at sharing funding opportunities that other agencies may have. If we have any, we work with that. But usually what VA does is we work with individual veterans, healthcare and benefits. And then we provide federal partner forums, is what we call them. And that's just, I'll talk more about that and some of the examples that we have done in the past or in the last year that brings together federal agencies into rural communities to share their resources. Next slide, please. So this is what I mentioned was the other federal agencies that we work with, and not just federal agencies, but also there's commissions. I think there's about 3 or 4 commissions that we work with. And if you look at this slide, there's approximately 20 federal agencies and commissions that all come together in this Rural Partners Network. Next slide, please. So this is a map that shows when the RPN first came out through the White House, they worked with cohort 1 is what they called it. And you can look at the brown colored states. These were the original states that they worked with. So there were 5 of them that they first brought to attention and looked at developing what they called community networks within those states. So that was the first cohort. And then shortly after, they came up with the second cohort. So that's the states in the blue, and that included Puerto Rico as well. So within each state, you can see some of them have the numbers in them. So like Nevada has 5, Wisconsin has 5. Let's see here, Arizona has 3, New Mexico has 3, Alaska 2. So what that represents are the 35 community networks that RPN focuses on. So at this time, that the federal government works specifically with these 10 states and Puerto Rico. And in the future, we're looking at adding more states to that in hopes of covering all states at some point. But I do want to note that VA doesn't just, VA, we don't just work with these 10 communities or networks shown here. We also work with other rural areas and veterans throughout the United States. So I just want to mention that as I show that map. And looks like we've gone to the next slide. So the rural.gov slide here, this is a resource page that the RPN came up, the Rural Partners Network came up with. And if you look at that, there's tabs on there that talk about what the RPN is. You can educate yourself on that. You can also look at what opportunities, what grants, other programs, and other relevant information for rural communities are. You can also sign up for, I think, alerts on that. But I do encourage you to go there and check it out if you're looking for programs and funding opportunities and topics such as rural health, education, housing, transportation, broadband, and more. So look at that when you get a chance. Rural.gov, and it's pretty easy to remember. Next slide, please. So I wanted to give you some examples of some of the activities that we've done. Like I said, we're only just over a year old. And in that time, when I came in October of 2022, we started doing outreach, we started doing events, and we also started doing, or collaborating, I should say, with the Rural Partners Network and what they call federal partner forums. So we started out with West Virginia was one location, and that was in May of 2023. In this particular slide, I worked with Ted Diaz, who actually worked in our office at IGA, Intergovernmental Affairs at VA at one time. He's currently the Cabinet Secretary for West Virginia Department of Veterans Assistance. And I pulled him in to collaborate to work with that state, and so they could get to know him and also work with state resources. In that particular event, we had 150 attendees. We had federal, state, local agencies, philanthropic organizations, and other community members that attended. And what we did was we just shared resources. We made introductions, points of contact, and who we are and what we're doing with this Rural Partners Network. Next slide, please. This next slide was with the Secretary of VA. He's really supportive of the Rural Partners Network and how can VA participate in this initiative. So when he came to me at the Office of Rural Engagement and said, where can we go? What's available? What rural community can we work with? And so we kind of looked down and strategically looked at some locations within the Rural Partners Network. Wisconsin was one. He was planning to do a site visit out there anyway with the CBOC and with the VA Medical Center. So what we did is we tied on a site visit to do a roundtable with USDA Rural Development. We had the Wisconsin State Director. We had a county VSOs who were present, and also we pulled in the VA Director, the Visit Director, 23, Robert McDivitt, who was able to listen to some of the challenges that rural veterans are seeing in Wisconsin. Also, like I said, we did a site visit at the Chippewa Valley Clinic and then Toma VA Medical Center. So that was a great start for the Secretary to do that. And then we had some other activities that we did with the Secretary in that support, in that effort. Next slide, please. So this slide shows another RPN Federal Partner Forum that we did in Mississippi, and that was in Greenwood, Mississippi. This was in August 2023. And then we worked or collaborated with the USDA Rural Development and also with Mississippi Representative Benny Thompson. And then we collaborated and hosted a roundtable discussion with the local community. We had federal, state, local community leaders. We had the American Legion, and also local veterans who were in attendance for this event. The mayor showed. We had other federal agencies like the Department of Labor. So it was a really good collection of federal, state, and local leaders. And the secretary was able to listen to the challenges in Mississippi and what was going on. We did some do-outs from that event. And then to add to that effort was we did have a claims clinic right after the roundtable discussion. So that was really successful. In that same civic center where we had the roundtable discussion, we had a claims clinic right after. So from 8 to 9 o'clock was a roundtable discussion. From 9 to I think 3 p.m. we did the claims clinic. And during that effort, we had 246 veterans that were seen, and then 168 claims that were filed. So very successful. Everybody was really, I think they were really appreciative that VA as well as the other federal agencies were able to go to those rural communities and do that type of work. Secretary also visited the Jackson, Mississippi VA Medical Center, and then he did a visit to the Veterans Benefit Administration regional office. I'm sorry, I just lost my train of thought. So the regional office, so he did 2 visits there. Next slide, please. So some of the other rural engagements that we looked at, and those were just mostly like high level ones that I showed as examples, but other ones that we did from last year is in May of 2023, we also did at Eastern Kentucky Highlands Federal Partner Forum in Hazard, Kentucky. So that was a smaller event, but we were able to get federal agencies there as well. And then we did some resource sharing presentations to the audience in that rural community. Also, July 24th, we had a claims clinic PACT Act resource fair in Alamosa, Colorado. So that one was, as I mentioned, VA, we don't just work with the 10 states in the Rural Partners Network. What we do is if we have connections with other rural communities, we want to work with them as well. So we don't want to leave anyone out. So in Colorado had contacted my office and said, we're looking at doing a claims clinic. Can you assist? So we pulled together, as I talked about it earlier, with the integrator, we connect people. So we connected the regional office. We connected with the state director of Veterans Affairs for Colorado. We also had VSOs, Veteran Service Organizations, who were on site and doing claims right there with veterans on site at this event. And for the metrics, we had 117 veterans that were seen. There were 73 claims filed for that event. A little smaller than the Mississippi event, but very effective. As far as if you're familiar with Alamosa, Colorado, it's a very rural area. They do have a clinic there, but then I think it was good to get the veterans out there during this PACT Act time to get signed up for their claims. So very successful, and hopefully we can do that again in other rural communities that want to partner with us. I do want to mention too that with these claims clinics, our partners, our internal partners, we work with the Veterans Benefits Office, the rural regional offices. We work with the Veterans Health Administration. Sometimes we'll have a vet center on site who we work with, who can do the behavioral health issues if we need that. Also, like I mentioned, the veteran service organizations or veteran service officers who take claims. So it's a really good collection of different partners that come together to make this claims clinic successful. And then August 23rd, we did another federal partner forum in Wilson, North Carolina. So that was a smaller event. I didn't get to go to that one, but I sent one of our fellows to that event. and turned out successful as well with all the federal agencies there and other partners. Next slide, please. So I want to mention that we do have some upcoming events, and then we just started strategically looking at what we wanted to do for FY or fiscal year 24, and what we have heard and what we have scheduled so far in February. Well, we're getting ready to be February right now. There's another one going to be scheduled for North Carolina. It's a community network event, similar to that federal forum that we did last year. So they want us to come back and do that. So that is to be determined. You can look on the rural.gov website to look for that date. They should be announcing that soon. March 12th through the 14th, we have an event in Las Cruces, New Mexico. It's a federal partner forum as well. That's going to be more than one day. So usually we have them for one day, one full day, but this one's going to be for, looks like 3 days. So it's going to be a great event if you're in the New Mexico area. Upcoming for May to be determined for the date. Another one in West Virginia, an all community network. So West Virginia has been really active. As you saw that we did that event last year, and they're doing another one this coming year. So really active in those communities. My goal is to look at other states, other communities that we can work with. And if you're interested in that, please contact me and we can probably set something up. It doesn't have to necessarily be Rural Partners Network, but VA can work with our partners in those rural communities. Maybe it deals with the clinics there in that area, and it could be with the VA Medical Center. So just feel free to contact me. I'll have my information at the end of the slide. Next slide, please. So another way we're connecting with rural communities is we have a newsletter, and we haven't done one in a few months, toward the end of the year. But now that we have new staff, we're looking at restarting our newsletters. We want to share information on grants, events, and other resources that are particularly specific for VA across federal government. And then you have that QR code. If you scan that, you can sign up for our newsletter and our information sharing with that. Rural.gov is another one I mentioned earlier that you can go to and look at announcements and other opportunities. And then the link below that is the Department of Veterans Affairs Office of Rural Engagement. That's where you can sign up as well as the QR code. And then, for other questions, you can certainly reach out to me through my email, which we'll have, I believe it's on the next slide. Next slide, please. Do we have that slide with my contact information? Go. There it is. So that's my contact information. If you're interested in working with VA on some of these outreach events, please contact me. You can email me at david.ward@va.gov. My phone is 202-461-7445. And then of course there's that QR code again that you can sign up for our newsletter, and then the website rural.gov. And I think we can go to questions.
Thank you, Clay, so much for that very
You're welcome.
Informative presentation. I learned so much today. I'm going to go directly to rural.gov and find out all the information on there about your program. And we're so thankful for you today. We are looking at questions right now. Wilm is typing something in the chat box, and we will find out what that is in a sec here. We are, if we have a lot of questions to address, we would definitely, or if someone online have a question for you and they haven't thought of it, and they do have your email address here where they can type a email or forward you an email with any questions that they may have if they can't think of anything right now. And I'm sure you'll be able to get directly back to them because we do have everyone's point of contact information that dialed in today. And I see that Mr. Morales have provided one question for us from Joe Koch. And he asked, is there any rural farmers training programs for veterans? Are there any rural farmer training programs for veterans?
I believe you said Joe asked a question.
Yeah, Mr. Joe Koch, Koch.
Okay, so yeah, so VA specific, there are programs, but not training programs. But I can send you that information. But I would also mention you can look on that rule.gov that I mentioned, or that's listed here, and then USDA has a lot of programs for veterans in farming. So I would actually look at that rule.gov and go under. There may be a topic for agriculture, and I think that's the topic you would look under. But that they certainly have programs for that.
Yeah, so true. USDA have so many programs for farmers. They do a lot of work with agriculture and research on that. And I'm sure that he could get a wealth of information from USDA.gov as well. And you did mention rural.gov. He can look on the rural.gov for a link to their website as well. I do not, I think Will is typing another question in the chat box for us right now.
Hey, True, are you able to open a mic? Looks like someone's got their hand up, and I think I might know this person from USDA.
I cannot do that, but Will can do that. The second question, and we'll go to the second question, but Will,
Okay.
there's someone that has their hand up. Clay said in the Q&A, you can find out their question. That would be great. But we do have a second question, Clay, from Mr. Anthony DeLucia. And his question is, how could the state of Tennessee become involved? We have some amazing VAs, community partnerships, etc. So how can the state of Tennessee become involved in your program, the rural?
Great. So what I would recommend is, Anthony, is if you just contact me by email, and I would love to work with you and get some resources out there to Tennessee. I know that Tennessee's not in the Rural Partners Network, but like I said earlier, as far as VA, we work with all states. We work with all rural communities, and I would like to partner with you at some point. I'm not sure what your organization is or what it does, but please get in touch with me at david.ward@va.gov, and I'd certainly like to work with you. I know the secretary, VA secretary, was in Tennessee, I believe it was last month, and he didn't do a real engagement at that time, but I would certainly like to tie that on next time he's there, or not, if not him, but other Rural Partners Network type of work.
Hey, Clay, I got a question. This is Conrad. Hey, listen, that question is pretty important. Would you say that being able to others who want to partner with you, I know you mentioned that, how would they be able to connect with you? Let's say someone else wanted to actually have an opportunity to connect with your office is one question I have for you. Same thing, connect with you, or is there, you go to your website?
I would suggest to just send me an email. I think that's the best way, the fastest way to get in touch with me, and we can set up a call. We can talk about strategizing how we can do some type of events there. And I'd also like to include you, Conrad, in your program as well, because
Sure.
we collaborate a lot with these type of events, along with Henry Huntley and the state and local office in IGA.
Yeah. Is there anything else you think you want the audience to know while we have them on the line before we let them go?
I just saw Anthony's, his question. He also mentioned that he works with the Appalachian Regional Commission. So that's a good thing, because ARC is part of the Rural Partners Network, and I'm actually getting in touch with them on some other matters. But yeah, Anthony, get in touch with me and let's see how we can work with you and ARC, Appalachian Regional Commission.
Okay, great.
Thank
Great.
you.
Back to you, True.
Thank you so much, Clay. I was about to mention the statement that Anthony made. They're from the state of Tennessee, which is a wonderful state we've had a chance to visit with, and look forward to working with them. As Clay has mentioned, please see his point of contact information on the screen here. David goes by Clay Ward. He is the Rural Desk Officer for the VA Office of Rural Engagement. Here's his phone number, 202-461-7445, and his email address, david.ward@va.gov, and his website, of course, www.rural.gov. If you need to reach out to our team as well, we will have our point of contact on the information on the screen in a second here. At this time, I'm going to turn the mic back over to Mr. Washington for closing remarks.
All I want to say is thank you, Clay, for taking time. I know you're busy, as many of us are, and even the attendees. Thank you all for joining us. We appreciate you. If you need additional information, our information is on the screen. You know how to get a hold of Clay. And hey, we look forward to you continuing to sign up for our future webinars. So see y'all and be blessed.
If you registered for this event today, we will provide you with today's presentation. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website and Facebook for future webinars and shared information. This adjourns today's webinar. Thank you for joining us today. Have a wonderful day. Goodbye.